Welcome to I Want Second Opinion. Last time we discussed about nosebleed with Prof. Raveendhran. Prof. Raveendhran is a classmate of mine, and he works as a head of the department at Annamalai University Hospital, and he leads the department of pediatric surgery. Prof, welcome back to the channel once again.
Thank you, Prakash. Thank you for the opportunity once again.
It's a pleasure. Your previous video of nose bleeding was very good, and we got a lot of calls from our viewers, and there were questions as well. It gave a lot of good insight to the public, and I look forward to meeting you in many more such educational videos, which would be of great importance to the public. Now, today we are going to another important topic, which is common in the pediatric age group: head bumps. Now, Prof, what should I do if my child hits their head? It's a very common scenario. What would be your line of protocol, or what would be your advice to the parents? It's a common scenario.
So, head banging is bumping or banging is of two types. One in which the injury occurs, but there is no external breach in the continuity of skin, no ulcers.
Okay.
Another one is head bumps associated with skin tearing.
Okay.
So the problem in the first one is the skin is injured but not breached. So blood will underneath. We call it as hematoma.
Okay.
Yes, hematoma.
Okay.
Some blood underneath the skin.
Okay.
The mistake parents do is they do massaging of that area, thinking that it will reduce the pain of the child. By doing massage, they will produce actually more bleeding inside the skin. So they should just keep it compressed and press it for some time.
Okay.
If they want, they can apply an ice cube there to reduce the pain as well as the bleeding.
Okay.
The second situation is the skin is breached. In that case, it is little more serious problem because the child is going to bleed from the cut edges of the skin.
Okay.
So in which case, they have to keep the wound pressed with a clean handkerchief or a cloth. Keep it pressed.
Okay.
Again, human tendency of blood vessels is they will stop by themselves by clotting over a period of 5 to 6 minutes. So the parents should keep the wound completely pressed with reasonable pressure for 5 to 10 minutes till the bleeding stops.
Okay.
So keep on looking whether the bleeding has stopped by removing the handkerchief. They should completely press it for 5 to 10 minutes by clock and till the bleeding stops. This is more important because the blood vessels in the scalp, skin, have the less tendency to clot by themselves. They can produce significant bleeding to exsanguinate the child. The child may lose considerable amount of blood to the level of developing anemia and needing blood transfusions. So this is a more serious trouble than compared to head injury in which there is no breach in the skin.
All right. Okay.
And the basic thing for both is do not massage the area, just keep it compressed by pressing, whether it is an injury or a closed injury.
Right. Okay. Now,
second thing is, the child develops injury to the head. Do not feed the child. Keep the child in empty stomach, because suppose if there is a serious injury inside the brain, the child may start vomiting, and while the stomach is full, the child will vomit the food contents and may aspirate it. That is more dangerous. So till medical help is secured, do not feed the child and keep the child empty stomach.
All right. Okay. Now, interestingly, you mentioned about the serious kind of head injury. How can me as a parent tell that whether my child has got a concussion, i.e. a serious head injury affecting the brain or not?
Yes, head injuries are of two types. One is external skin level injury.
Okay.
This is usually the case in case of home accidents like hitting against a wall or object, etc. Because the amount of force is very minimal. There is another type of head injury which the hitting force is very severe, like falling from great height, 6 feet or 7 feet height, or getting banged in the road traffic accident against moving vehicles. That is a more serious injury in which there is likely to be injury to the underlying brain. That is a more serious affair.
Right.
So the most important thing is whether the child is having internal injury to the brain or not. That is the most crucial question in every head injury.
Yeah.
To be honest, even doctors find it sometimes difficult to decide this. That is why Hippocrates told no head injury is to be feared, no head injury is to be ignored. So it is either way.
Very nice way of telling. Okay.
So no head injury need to be feared. No head injury should be ignored. This is the Hippocratic dictum.
All right. So the onus lies on where and whom here.
Yeah, the onus lies on all stakeholders, parents as well as the doctors.
Okay.
The way to identify whether the child is having some serious injury to the brain, that anybody can recognize, even the parents can recognize. One is, after the child will become unconscious for a short, brief period. That is called, call it as lucid intervals.
Okay.
So the child will become unconscious.
Okay.
After that, he will wake up, but continue to have normal activity.
Right.
But the unconscious period for 2 to 5 minutes is very important clue for underlying brain injury.
Right. Okay.
The second thing is the child may have continuous vomiting from the time of injury.
Oh, okay.
That is underlying brain injury.
Okay.
Obviously, if the child has convulsions, seizures, or fits, rhythmic contraction of limbs, that is a sign of serious head.
Right. Okay. Okay. So,
and if the child has any problem in lifting the leg or hand or fixing the gaze of eyes, these can also be a sign of underlying brain. So there are four things. The child will become unconscious immediately after the injury, may or may not regain his consciousness.
Okay.
Second, vomiting. The child will have difficulty in raising legs or things.
Okay. All right. And you told about the convulsions. Okay. All right. So in these sort of circumstances, the child should seek immediate medical attention. Is that right?
Yes, exactly.
And you mentioned about the lucid interval. Can you elaborate more on this? Because the parents might not notice this because the child might be awake and running after 10 minutes and stuff like that. What should we be aware here, like as a parent?
The term lucid interval came from football game. It is common for the footballers to have the ball hitting their head. Externally, there won't be any injury.
Okay.
He will put punches in the ground for a few minutes and get up and continue to play the game.
Okay.
Maybe 24 hours or 36 hours, he will slowly sink into unconsciousness and die. So this is the nature of a lucid interval.
Okay.
This can happen even with the small home accidents also. Some soft hitting of the head. So that is possible.
Right.
In some cases, the child will be unconscious for a brief period, say 5 minutes or 6 minutes after the injury. After regain full consciousness, have full normal activity, only to slowly deteriorate after 24 hours.
Oh, all right. Okay. So it's better for the parents to keep the kid under observation for a while. Okay. If that is going to be the case, is it better for the child to take rest after the head injury? How long is the interval for taking rest or be under observation under the parents?
I won't say that the child should have restricted physical activity after head injury, not
Okay.
necessarily. But the child should be under keen observation for next 48 hours or 72 hours.
Okay.
Who is little knowledgeable about the injuries should watch the child for next 42 hours, 72 hours. And the parents especially should watch for the 4 warning symptoms I told.
Mhm. Okay. Can you reiterate once again to the parents, please?
So the 4 cardinal warning signs are vomiting after injury, a brief period of unconsciousness followed by normal activity. The third one, convulsive movements of legs and body. And the fourth one is inability to move the limbs.
Fantastic. Now, Prof, there has been some mention about not to give ibuprofen after the head injury. Is there any particular reason behind that, or?
Yeah. All these painkillers vary in their strength and activity.
Okay.
Usually, ibuprofen is a more powerful painkiller than paracetamol or acetaminophen.
Okay.
So the ibuprofen, when it is given, it reduces pain and also at the same time impairs the clotting mechanism of blood.
Mm. Okay.
Suppose there is a bleed inside the brain as a
Mm.
consequence of injury,
Mm.
dose of ibuprofen can actually aggravate the bleeding inside the brain.
Right. Okay.
At the same time, I won't prevent using a milder form of painkiller like paracetamol that is
Okay.
essential to control pain for the child.
All right. Okay. So better to avoid anti-inflammatories, give analgesics rather.
Yes.
All right. Okay. Now, when the child is brought to the emergency department, what does the doctor do in this sort of circumstances?
So when the child comes to emergency department, we try to assess how serious the injury is. So based on the parent's history and the history of nature of injury, we always take into account the amount of impacting force.
Okay.
So it is directly proportional to the seriousness of the injury inside the brain.
Okay.
So account. And then we examine the child for any deficit of nerve function, like inability to lift the leg and lack of sensations.
Okay.
The test we do is ask the child to smile.
Mm.
This type of smile is not possible sometimes if there is a serious injury.
Okay, that's a very simple test. Okay.
See, I'm just demonstrating in the camera.
Okay.
This is normal.
Okay.
Suppose if the mouth deviates to one side like this, this is abnormal.
Right. Okay. Okay.
That means there is something serious inside the brain.
Okay. So this is a simple test where the parents can even do it at home to get an idea of what the children is going through. Yeah, of course, this is for the doctors to examine. But is this?
Yes, parents can very well do this smiling test, but they should be beware that a negative smiling test does not rule out serious problems inside.
Absolutely. Okay. Yeah. I understand.
Positive, they can be sure that there is something serious. But if the test is negative, there may be or may not be something problem. So they still have to consult a doctor and not waste time by deciding themselves.
Fantastic. Good. In nutshell, Prof, if you have to give a consolidated piece of advice to our parents for the kid who has suffered head injury, what would your advice be?
As I said, no head injury needs to be feared. No head injury should be ignored. So
Golden.
you have a watchful approach to the whole problem.
Okay.
Every head injured child should be evaluated by a physician or a doctor, qualified doctor, to rule out a serious problem underlying. The doctors will usually go by clinical methods or sometimes they may require imaging studies like MRI or CT of the skull to rule out brain injuries. That is very important.
Okay.
And as a parent, they should watch the injured child for next 36 hours or 48 hours for any development of the unconsciousness, vomiting, or nerve deficit functions.
All right. Okay. Fantastic. Prof, tremendous inputs. Actually, I'm sure the parents would be benefited because it's such a common thing. The head bump happens, and it's a kind of a concern for the parents. And we really appreciate your inputs that you have given, and we look forward for getting many such insights from you in the forthcoming episodes. Thanks, Prof. Much appreciated for coming over here.
Thank you, Prakash. Thank you.